Again, thank you so much for this. I think this is very informative. I have two questions, but first I would like to start with a statement that I'm very good with very likely, and I'm also very comfortable with what Health Canada put out. And I think that's something that we must acknowledge, that this is not something we need to spend a lot of time speculating about. So my two questions are, number one, when we look at how we're going to connect with veterans and in terms of screening, I know that a lot of veterans in Canada move to rural and remote communities. And so access to those kind of supports and services can be a challenge. So I just want to talk about how to make that more accessible. And the second question that I have for you is that what I have learned from this process is what we don't know is very concerning. So what type of research actually would be helpful for us? You know, I think earlier I heard one of you talk about why are some people more sensitive and some not. That would be interesting to know. But is there any specific research that would really help active members and also veterans? Thank you.
So thank you very much. So Canadian Mefloquine veterans have been fairly consistent in recent years in calling for three things that we need, that they need from the Canadian government: acknowledgement, outreach, and research. In that order, in that order. Acknowledgement, as I mentioned initially, is the single most important thing that can occur. Because with an acknowledgement, with a mea culpa, with a statement from someone in a position of authority, simply stating the obvious that follows naturally from what is in the product monograph, simply acknowledging what is very clearly true, so much will come from that. Individuals within the halls of government that know Mefloquine is dangerous, that have patients that they would like to write case reports on, that would like to fund and conduct research with existing funds, will feel empowered to do this. Clinicians will feel empowered to diagnose on paper and for the record what they already know to be true, that they previously perhaps had been hesitant to. So acknowledgement must come first. Someone must say, this drug has caused disability among our troops. It's as obvious as day. Then outreach. With that acknowledgement, what individuals are not reached by the media, what individuals are not reached by social media and word of mouth, we can identify these individuals. We should know who has deployed in the last 25, 30 years to areas where Mefloquine may have been used. Hopefully, there's a postal mailing address or some other way to get in touch with them. And it could be as simple as saying, did you take Mefloquine? Did you have problems on the drug? Then call this number and we'll get you the support that you need. And then research. Now research comes in many flavors and varieties. And the type of research that you will hear about from government scientists and others who manufacture doubt about the dangers of this drug, this is not good quality research. It's retrospective research. It's based on existing data. And if we don't ask the right questions about symptoms experienced by individuals who have taken Mefloquine, if we don't ask specifically about their Mefloquine experiences, the existing data on which many of these studies are based is not going to capture what actually happened. So new prospective research, new research at patient level conducted with the involvement of clinicians is going to be essential. And so it really begins with case finding, empowering individual physicians to identify those veterans who are suffering the long-term adverse effects of this drug, getting them the type of sophisticated testing that I believe one of your earlier witnesses had discussed, fully describing the extent of their symptoms, and then beginning to count them and beginning to add them up and then beginning to figure out what they have in common with each other to identify these risk factors that we're alluding to. So the first step is not to ask Veterans Affairs to look at the existing data again or look at the existing research again and come to the very same conclusions. To solve this problem, we need acknowledgement, outreach, and research. And a component of that is the screening process that we described.
And if I could take part two of your question, what are the sort of big issues? Again, suicide is an obvious one. In the United States military, it has grown over time, not all related to Mefloquine. I understand that suicides in the Canadian military have also increased over time. I don't know if it's related to Mefloquine, but that's one of the most tragic aspects when it does happen. So if you looked at suicides, it would probably, and you may have already been doing this, I haven't heard of it being done in the same way we have in the States, but it would inform a lot of things besides just the Mefloquine.